program, right?
It's actually only 3. So that's good.
That's great. And you're from Michigan?
Yeah.
You're doing your med school
Yeah.
up there, and then Michigan's a great state. I do love Michigan. I'm here down in Indianapolis, not that far. My whole family's from Minnesota. So between Indiana and Minnesota and going back and forth, I've spent some time kind of up in Michigan and then Wisconsin and Minnesota. But it's a beautiful state.
Definitely Midwesterners at heart then.
Yes.
Yeah.
What
Yeah.
are some of the other topics this group has talked about in the last year or so?
So we've talked a lot. Good morning, everybody. We're just waiting for folks to log on. We've talked about addiction and the human person. We hosted Ruth Graham from the New York Times and her work covering religion as a reporter for the New York Times. So a lot of different things. Yeah.
Oh, that's fantastic. Wow.
All right, friends. Good to see everybody again. We're going to go ahead and get started. Good to see everybody. For those of you who don't know me, I'm Kristen Collier, and we are really thrilled to welcome you to our April session of our Wall Family Speaker Series on health, spirituality, and religion. So just a few announcements before we get started today. I wanted to highlight next month's session. It's going to be the last for the academic year before we take a break, as we usually do for the summer. Our session is titled Pregnancy and Torah Texts, What the Multivocal Jewish Tradition Offers to the Motherhood Discourse. We know that many women think of their pregnancies as miraculous, which they are, but experience them at the same time as profoundly challenging. So in this talk, we will explore these two conflicting narratives of pregnancy through the lens of early Jewish texts. We will explore what it means to hold these two truths at the same time and wonder what these texts can teach us about our approach to the manifold experiences of pregnant women. Our speaker will be Rabbinate Leah Sarna, who is the author of Begetting and Beginning, the Torah of Pregnancy, Birth and the Beginning of Life. She'll be presenting for us on Friday, May 10th at noon. Also, Dr. Adam Bruch and I continue to hold office hours. Please see our email for details. If these times don't work for you, we are totally happy to meet with anybody at any time. So just let us know. We can set something up. Okay, now on to today's session. So we have made it a point in the program to have our student fellows, if they're interested, invite a speaker for our Wall Family Speaker Series, and then run the session as they see fit. So today, one of our fabulous student fellows, Jill, will be introducing our speaker and our session, and she'll be running it. So Jill is currently a fourth-year medical student with us here at Michigan, and she has successfully matched into emergency medicine. She'll be doing her emergency medicine residency in Metro Detroit at the Beaumont, now named Corwell Health System. So we're excited to have her run our session today and introduce our speaker. Jill, take it away.
Okay, great. Thank you, Dr. Collier. So yeah, thank you everyone for coming. And I have the great joy in welcoming Dr. Laura Vater, who, as a little introduction, is an oncologist at the Indiana University Simon Comprehensive Cancer Center. She earned her MPH from the University of Pittsburgh, her MD from the Indiana University School of Medicine, and completed her residency in internal medicine and fellowship in oncology at Indiana University. She's a member of the Pegasus Physician Writers at Stanford University and has published several narrative medicine essays. She's also developed a tool to help patients and clinicians prioritize their health called the SMILE scale. So without further ado, we welcome Dr. Vater to share her thoughts and insights with us today. And then hopefully at the end, we'll have some time for questions. So just save those up for the end. Thank you.
Thank you, Jill. Congratulations on matching into emergency medicine starting this July. That's wonderful. I'm so excited for you. Thank you, everyone, for joining us today. Thrilled to be here. I wish that I could participate in all of your sessions. I was just thinking about the one about the Torah and pregnancy and all of just how nuanced and beautiful that is that you're studying religion in this way and spirituality. So I'm honored to be here. I know that Jill and I had talked about what kind of talk might be best for this. I talked to a lot of medical students about this topic, but I'm hopeful that this can be helpful for other seasoned practitioners as well. But we're really going to talk about how do we get back to finding joy, health, and meaning in our work. I'm an oncologist. I do GI oncology, so I take care of patients primarily with really aggressive and metastatic cancers. So I take care of primarily patients that have pancreatic cancer, metastatic colorectal cancer, liver cancers, just really cholangiocarcinomas, those things that Jill's going to be diagnosing in the emergency room and things that often get sent to me. And My mentor told me when I was starting my practice, 85% of your patients are not going to live long term. Unfortunately, you're going to have you're going to have really intimate and short relationships with your patients for maybe a few months, maybe years. But most of my patients, I end up walking them through the end of life. And so, because of the work that I do a lot of palliative care in my work. I take care of for people that are very ill. And that's why I'm really care a lot about this topic, because it's something that's very personal to me. How do we continue to do really hard work? And we all have hard work, whether you're in the emergency room, whether you're a surgeon, whether you're doing primary care, whatever your specialty is, the work that we do in medicine is hard, to witness illness and loss and trauma and death. And it affects us, right? So how do we find a way to move forward? That's what we're going to really talk about today. So how do we connect deeply with patients, really get back to what the heart of medicine, I believe, and I think all of us in this room really believe, how do we care compassionately for our patients? How do we find ways to better care for ourselves in a really convoluted and in many ways broken healthcare system? How do we have self-compassion for things like medical mistakes or compassion fatigue? And then how do we build in practices to cope with these difficult aspects of our work? So that's really what we're going to jump in today. When I talk to students, I think back to when you were a medical student, what we thought and hoped a career in medicine would look like. We have lots of time with patients. We have deep connections with them, lots of satisfaction. We're improving the lives of others. We're helping them navigate really hard conversations, and we're present in the moment with them. Ideally, we have reasonable workloads with adequate support, whether that's pharmacy support, nursing support, other support from the people that employ us, or if we're self-employed, from our colleagues and our our subordinates and whatnot. And then also, how do we have time left over? How is there anything left over for our families, our health, our hobbies? I know we have some learners in the room. We have some seasoned practitioners in the room. I don't know if any of you have children. I had my daughter when I was pregnant most of my third year of medical school, because I was a non-traditional candidate, had taken time off before med school. And now my daughter's 7, right? So I walked through training with an infant, and then started intern year with a 1-year-old, and then so on and so forth. And it's something I've thought a lot about, is how do we carve out time for the things and the people that really matter in our lives? And it's not an easy thing to do. I think for most of us, what practicing medicine can often feel like, not to discourage anyone who's still jumping into this field, but it can feel like a lack of time. There's this pressure to move faster. I write novels. I'm actually working on my second novel, and my new main character is going to be a primary care doctor who's really in the first scene facing this, right? What is this pressure to move faster? My mother is a primary care physician, also facing this. What happens when you have 30 minutes with patients and now all of a sudden you have 15, or you have to work more days, or there's this pressure, right, to see more patients in less time? What about documentation demands? What if you're charting on your days off? You're trying to manage your inbox, right? You're sometimes falling asleep on the couch, just trying to get your work done, feeling behind, right? I don't know if that resonates with anyone. You're feeling behind on your notes, your messages, your modules, your research. Just there's a constant list of tasks. I work in academic medicine, right? And so there's all of these things. And then, of course, you're just trying to take good care of patients. But we're being paged, we're being called, we're being pulled out of rooms. In the emergency room, there's emergencies, right? Even in my clinic, sometimes I'm pulled out. Hey, we need you. There's someone in the waiting room not doing well. And so lots of interruptions. How do we be present in these moments with patients that are really important? Of course, then this may lead to guilt, not having enough time. I have a lot of people, I do a lot of advocacy work through social media. I have about a community of about 155,000 people now. And I have a lot of people reach out to me and say, I had to leave medicine because I had this huge amount of guilt. I couldn't be the doctor I wanted to be. I couldn't provide thorough, compassionate care in this short amount of time, or I couldn't do the work I wanted to do in this system. And I left healthcare altogether. Or nurses who are short-staffed and they are leaving the bedside. They're looking for other careers because there's this guilt, there's this moral injury, and this is serious stuff. And then there's compassion fatigue. There are medical mistakes that we all face. And then, of course, lack of time. We talked about that. This can lead to depression, anxiety, thoughts of suicide. When I was in my internal medicine residency and I was working, I had 5 months straight where I was working really, really fragmented shifts, lots of long hours, and I had thoughts of suicide. And I remember driving home after I'd been awake for about 35 hours at that point, thinking, I don't really care if I make it home alive, right? It's almost like I'd lost my vitality. And even though my daughter was 3 at the time, and it was really her face that kept me going, thinking, I don't want her to grow up without a mother. And these are serious things that we face in the field of healthcare, things that I don't think we talk about enough. But for many of us, that can lead to addiction, that can lead to a desire to leave medical practice altogether. Maybe these are some things you've talked about in this group before. I don't say these things to be negative or just to discourage, like Jill, who's going into this field, but I do think it's important to normalize some of these conversations and really talk about strategies, right? Each of these is a specific thing and they're all interconnected, but how do we find ways to just get back to this? And how can we possibly find joy and meaning in this current climate of medicine? There are a lot of people that say, it's just not possible, so I'm out. I'm leaving it all together. But how can we do this incredibly meaningful work and still sustain ourselves? And that's something I think about a lot. I'm not going to say here that I have this brilliant big solution if I did, right? I mean, I think that many of you in this room probably think a lot about this too. But in the work that I do, there's a lot of grief, there's a lot of loss, but I love my job. I love my job. And I think for me, what really, really matters when I think about why do I love the work that I do, it's really connection. I think that it's connection with patients that is what is the most central aspect of medicine. And I think that's what's going to sustain us. And I know that's probably something in this group, we were like, of course, well, of course, why not? That is the most important thing. But I think that this is missed throughout medicine, especially with this desire to see more patients and to practice quicker and to just do more in less time and to have all of these things that distract us, whether it's the computer or the phone or the phone that's paging us. It takes away from that precious time with our patients because we simply cannot be present, thorough, compassionate doctors if we just don't have time with our patients. I think that is the most central aspect, is fighting and holding on to that time with your patients. I think if you have the ability, so if you are in training, if you're in school, if you are even in your own practice, how can you protect the time that you have with patients? Even if that means you see fewer patients or make less money. I think this is something that my husband's a stay-at-home dad. I live in the Midwest, woohoo. I know you're in Michigan too. So quality of, cost of living and quality of life can still be very good. So we are, I provide for our family, but I'm also have to be very cognizant that I have to see patients to make money. And so it becomes this dichotomy of, I want to see patients, I want to have time with them, but I don't want to see so many patients that I don't derive meaning and value and work in my day. How do I do this? And I'm still figuring that out. I think we all are. But I think if you have the ability to live below your means, to live simply, to not, right, to buy a smaller house than you can afford, to spend less money than you can afford to spend, to help protect and to save and to have more time to that, at least for me, I think that that's something that's really a practical strategy that's helped me to continue to derive meaning in my work, is that I actually have time with my patients. I can sit down with them. For my patients, when they're doing great and everything's fine, they're feeling well on chemotherapy, it can be a very short visit and it's fine. But for my patients where they get a scan or there's something big going on in their life, just being able to have that margin. I think for me, it's margin of time with my patients of saying, your scans are showing that this cancer has changed or progressed, right? We know, at least in oncology, I don't know if anyone else here is in oncology, but there can be this focus, they call it this collusion, where the patient and the doctor and the oncologist are so focused on the next treatment plan. And that's the easy thing to do. The hard thing to do is to step back and say, are we doing the right thing? Is this person really well enough for more treatment? Is that really what they want? Do they really understand what that means? What are the options? What are the alternatives? What are the really to talk about these hard end of life conversations, these goals of care conversations that take time, right? If we're going to provide thorough, compassionate care to our patients in the moment that they need us, that takes time. And I think for me, when I rush through those moments, or if I'm double book or trip, I start to feel it, right? My heart is racing, and sometimes I'm feeling that chest pain or I'm feeling that anxiety of saying, I just wish this person would stop talking. And it's terrible to say that, right? I wish that this person would stop talking because I have to get on with my day. And I hate myself. I hate that feeling. I hate that shame that comes along with practicing medicine in a way that I don't feel aligns with who I really am as a doctor. So to me, the priority is to have more time with patients, to have margin, to try not. Yesterday I was in clinic and I was like triple booked at 11 o'clock. And I felt that. I was like, oh, I was covering for one of my partners. And here I am trying to do a good job. I've got a resident in my clinic. I'm trying to teach her, trying to do and manage all of these things all at once. And I felt that. And it says, okay, I want to take a step back. I used to give talks like this on my clinic days. And then patients would end up coming late or the lab would be late. And I would say, okay, new boundary for me. I can't give talks on my clinic days, right? And so I think it's, what are those boundaries for you, and what are those priorities for you, and how can you continue to carve out time with your patients? I think when you're with a patient, I tell this a lot to students, really simple things you can do. Go in the room and sit down. When you're sitting down, patients feel like you spend 3 times more time with them than you actually do. On average, we interrupt patients about every 8 to 11 seconds, depending on which research study you look at. So if you can go in the room and ask an open-ended question and just listen for 45 seconds to a minute, for most patients, not all patients, but most patients, they'll be able to share with you what really matters, what brings them to the emergency room for Jill, or for how they're doing with this round of chemotherapy with me. And then I just try to sit back and listen to that answer. And then I ask my follow-up questions. But if you can sit down, remove your distractions, be present. I am notorious for leaving my phone outside the room when I'm in clinic. And then the infusion center is paging me, and this person's low on electrolytes and all these things. And my nurse will knock and kind of pull me out if it's urgent. But I try really hard not to be distracted when I'm in the room. If I'm using the computer, I try really hard to involve the patient in that. Here's your scan, here are your labs, let's talk through the next steps. But if you can eliminate those distractions, I think it provides more peace to your day, right? So it's not just about getting through your day, but how can you derive peace in your day? For me, it's being focused on the person in front of me. It's paying attention to the detail. Even if I feel distracted, sometimes I'll look at the details of their face, their eye color, the way that they smile, the color, the subtle colors of their hair, the frame of their glasses, some details about the person that joins them. Just trying to bring me back to the present in that moment. I think that's something I try to do a lot as a writer, is to be present. But so much of medicine is just constant distraction. So being present, I think, provides peace to my day. And I think part of that piece is not being rushed through my patient care and just simply being present. And that helps me to be connected to patients. And then I derive joy from that, because when I look at my patient list, and I'm sure those of you who have clinics here, you look at your list maybe the night before, the morning of, and you're thinking, okay, who's coming to clinic today and what do I need to do? And if I have a really busy clinic like yesterday when I was triple booked, I was prepping it the night before and really thinking what cycle and who needs scans and what are the moving parts and who are these patients I've never seen before. And I think that helps to be prepared in clinic if you can, but also just looking at that list and saying, okay, that's not the person that has stage 4 pancreas cancer. That's Jim, and he just went on a trip with his family, and I can't wait to hear how it went, and I wonder how his grandkids are doing. And I think that there's such joy when you can look at the patients you're about to see, whether you're an intern and you're rotating through the ICU, or whether it's your own clinic and you're looking at a list of patients, and they're not just diagnoses, but they're people who you know, and you know things about their lives beyond their diagnosis. For me, that helps me to derive a lot of meaning and joy in my work, because I look at it and I say, oh, I can't wait to see that person. And there's a lot of laughter in my clinic, and I think that surprises a lot of people in the work that I do. But my patients just give me so much joy. Even if my patients are dealing with stage 4 incurable cancers, they will tell me. I had this patient that just celebrated her 60th birthday, and she went to North Carolina with her best friends, and she took this video of herself. She was like dancing. She went all the way to the floor and came all the way back. And she showed me this like 30-second video, and we were all just like laughing so hard in the room. And there's so much joy when you connect with people. And I love that aspect of my work. I love how diverse my patients are. I love that I get to connect with them. I love that I get to see them regularly. And yes, that makes it harder when they pass. And that is something that we'll talk about. But I think that connection and that presence really is where the key to meaning and joy in medicine is. And, I think before, just last on this slide, if you're a learner and you're thinking, well, how do I do this? I'm rotating through all these different patients. Something that helps me is just the visual of the door frame, or it can be even sanitizing your hands outside the room, just to reframe. The way I do it is when I'm about to step through a door frame, I say to myself, this is a person on the other side of this door, a human being who needs me to pay attention, who needs my care. I'm going to set aside the other distractions, whatever that was, and I'm going to be present with this person in front of me. And that is just a little reset, whether it's washing your hands, maybe it's stepping through a door frame. And I do that when I come home. So there's the door frame of me as I'm entering through my garage into my house. Okay, there's people on the other side of this that need me to be present and to pay attention. And I think that's something that has helped me to try to be more present in my day. I just want to, for those of you who are in training or learning, I think that this is something where you're often told to put out your interest, you have your interests within medicine, And then you have your interests outside of medicine. And I think most people are said, okay, your interests outside of medicine, okay, just don't talk about those in your interviews, just kind of push those aside. And I think for many of us, medicine is so all consuming, especially in school and training and practice, that it can be hard to carve out time for what matters most. But remember that you're a unique person, you have unique gifts and talents. I really want you to think about what matters most to you. That could be certain relationships, that can be certain hobbies that you have. For me, that's writing, both narrative writing and novel writing. So can I carve out even 15 minutes on the morning of a clinic before I go to work, just a little bit of time to stay within the thing that I really love? I think that that really helps. And then if you're trying to figure this out for you, my mentor once described it as these buckets, right? And so I have three, you can have like 2 or 3 buckets. My buckets are, GI oncology, this what I call humanism and medicine bucket, which is really caring for the patients as people and caring for clinicians as people. And then my third bucket is writing. And so working in academic medicine, if I have opportunities and they seem like good opportunities and they fit within one of those buckets, then I look at my schedule and I look at the things I have going on, and can I take on another committee or can I take on another project? And if it fits within one of those buckets, I consider it. I don't answer right away, but I consider it. And if it doesn't fit within those buckets, I kindly say no. And I think that that's okay. You can say something like, this is a kind gesture. I appreciate being considered. It's just not the right fit for me. I think that that's one way that you can help. Something else that can, for everything else, how can you get more support, whether that's nursing support, pharmacy support, a scribe, documentation. I guess my clinic that we're about to launch, I don't know how it's going to work, but like an AI scribe. I don't know if any of you are in that process yet, where there's going to be an app that can somehow write a note for you. I have no idea how it's going to work, but how can we have support, inbox management, help at home, hiring someone to clean your house, whatever that is? How can you get support so that you can say yes to the things that really matter to you and no to the things that don't? And then try to set a boundary. If you have a day that's just chaotic and you can just analyze that day, just really objectively, what went wrong this day? And can you set a boundary? Can you find another way to say no or protect your time, your health, your relationships? In our work, there's a lot of things that are unpredictable. Some days you're just going to have a chaotic bad day that is no one's fault, that just happens because patients are sick. And of course, we can't control that. But within the aspects of things you can control, can you find a way to do that? So that's just something that's helped me. So how do we cope with difficult things? I think that we see a lot of this in our training. I remember the first patient that I ever saw who died. This was when I started my intern year. I went to medical school where I also started my residency, and I was in the ICU in the highest coding floor of the state, essentially my first month of intern year. We didn't have upper level residents. We didn't have fellows. We had just one staff that covered 2 interns, but the staff, of course, was busy and it was highly involved, just not often physically present. And I remember admitting a patient from the ER with a terrible COPD exacerbation, and we were admitting him up to the floor, and he ended up coding in the elevator, and then he ended up coding 5 more times on that first day. And I remember just driving home that night, thinking about his wife and thinking about that patient, and just really not knowing how to process it. I know that a lot of medical students experience death early. For me, it was my intern year, and that first month of my intern year, it was really, really devastating. There were just a lot of people who died, and it was really hard. And so I knew right from the beginning of my training that I had to figure out, how in the world am I going to be able to process this without just repressing it in a way that is going to allow me to continue to do this work? And in the work that I do now as an oncologist, right, I do not see car accidents every day like you will, Jill. I do not see people with gunshot wounds. I do not see people that have health completely there, and then the next second devastated, right? That I think is particularly difficult for families and for patients. But I do give a lot of diagnoses of cancer, and I do help patients navigate conversations surrounding death. And it is hard to lose patients. For me, I think people will say, and you're going to hear this, and I know there's this element that when I see another patient that has stage 4 pancreas cancer, and I know that I'm not going to be able to cure their disease, right? There is this part of me that I know that I'm going to be seeing this person today and through the end of their life. Some people may say, well, care for them well as a doctor, but don't get too connected because it's going to be too devastating when you lose them. I've tried that in my training to kind of emotionally disconnect, and I have found that I just don't like going to work when I don't know who my patients are. And other people have kind of different ways of coping with that. I do think it gets easier with time. The more that you are comfortable caring for patients, you can still connect with them and process and cope. But I think there's a lot of things we can do. We can do these for our learners, we can do these in ourselves, but we know that debriefing. So if I have a really hard conversation with a patient and there are tears and there's lots of emotions, and I think in the work we do, there's anger, there's frustration, there's sadness, there are all these things that are really just grief, that the patient and their family are experiencing grief about illness, trauma, death. But if there's something terrible that happens, whether it's a code or even a hard conversation, and I'm with my learners, sometimes even just saying, walking out of the room, being out of earshot of the patient, just being like, gosh, that was hard. Just acknowledging that it was hard, acknowledging that it was difficult, acknowledging that the work we do is not normal. I think that can go a long way. Allowing space to debrief with your colleagues, I think that can really help, especially if it was something that was not expected in a particularly young person. At any age, it's difficult, but if it's unexpected in a young person, that for me as an oncologist has been the hardest time. If someone has died unexpectedly from chemotherapy, especially if they're 20 years old or 30 years old, or they have young children, I think that is particularly hard for their families. But really just saying, we need to find ways to process this. Things that have helped me, I have a therapist who is actually a specialist in helping clinicians who experience grief. That's been something really helpful for me. And it's not just, we don't just talk about patient care, we talk about relationships, we talk about parenting, we talk about stressors of work. I think that's been really helpful for me. Journaling has been something huge for me. I don't know if any of you here journal or are familiar with the concept of parallel charting, which really is this concept developed by Rita Sharon at Columbia, which is this idea that all these emotions are going to be evoked when you care for certain patients. They may remind you of your child or your grandfather or whatever that is, and those can't go in the chart, but they need to go somewhere, right? So it's this idea of having this journal or this parallel chart where you can process and cope in a HIPAA compliant way, right? Not having patient identifiers, but just being able to process through the things that you're experiencing, especially if there's something like a medical mistake or something that's there where you feel moral injury. That can really help. Of course, spending time in nature, and then even having a ritual in the event of a patient's death. It may just be that you turn on your car for the day, you go home, or you're riding on the train, and you just take a few minutes to think about that person and to honor them, depending on your faith, praying for them, praying for their family. Some people like to write in sand and then wipe it away. Some people journal about it. Having some type of ritual in the event of a patient's death can be something that can help you process and cope. I'm just going to pause here because I know I want to leave lots of time for questions. Let me just see what time it is. I give a whole grand rounds on medical error and self-compassion because I do think that it's an important component of the things and the work that we do. I'll just give you kind of the abbreviated version of this for time. But I really like this quote. This was from 1984 by Dr. David Hilfiker, that modern medicine has created for the physician an expectation of perfection. Technology seems so exact that error becomes almost unthinkable. We are not prepared for our mistakes, and we don't know how to cope with them when they occur. This perfection is a grand illusion, of course, a game of mirrors that everyone plays. Unable to admit our mistakes, we physicians are cut off from healing. We cannot ask for forgiveness, and we get none. We are thwarted, stunted. We do not grow. I'm putting this in this talk because a lot of my colleagues that have either reached out to me personally or in training or elsewhere, a lot of things that can kind of thwart health and joy can be working through how do you process through when something terrible happens. And if we're practicing medicine, if we are entangling our lives with other people, at some point in time, it will be the wrong medicine or the wrong dose of a medicine or a procedural error or something, and we're distracted in the moment and the wrong thing happens, right? We are all human beings. And this will happen at some point in our lives and in our practice. But this really, really can lead to all sorts of things. Of course, we know that certain things contribute to medical errors like sleep loss and burnout and depression. But here are the mental health implications. I mean, they're huge. Guilt, anguish, inadequacy, shame, fear, caution when treating other patients, drug and alcohol use, depression, increased risk for suicide, even leaving the profession, right? So this is something that I try to normalize when I talk to residents as well, because I think it's really important to find a way forward finding a way forward when a medical mistake occurs is not easy. I'm sure there are people in the room who have practiced medicine who have been through this. I have been through this. I think we all have or will at some point in time. But it's really hard not to feel those feelings, not to feel like you want to crawl into a hole and never emerge and never practice medicine again. There is this 4-step therapeutic approach I want to share with you from the literature, but it's really about taking responsibility, repairing damage, apologizing to patients, being transparent with the support if you're in training, with the support of your attending of what's the timing of that, what's the right way to do that. And then eventually allowing yourself to release those negative emotions to allow for healing. This may take years. Things like we've already talked about can help, like journaling, therapy, and support. It's really often how the way we can cope is really based on the support that we receive from others. And that's what the literature tells us, is that if we face support and we have a colleague that we can rely on, that our ability to heal through that is going to be much improved. But if you're facing something similar, or you're going through a period of time where your mental health has declined, a medical error, overwork, sleep loss, for any reason, I just always say this: you do not lack resilience. It's not that you're weak or defective. You're not alone. I know that when I have had decline in my mental health, I felt this way. I felt that there was something wrong with me. Certainly, it meant that I maybe shouldn't be in medicine or was weak or defective. We know that even up to about half of medical students experience anxiety. We know that about a third have depression, and about 1 in 10 have thought of suicide. The data for doctors in training, of course, is very high. We know that physicians have among the highest suicide rate of any profession. These are real things that we're talking about, and really important things. And so just want to leave a few confidential resources. There is a free physician support line. Of course, there's 988 as well, which is the national hotline. And then psychologytoday.com is a great website to find a therapist if you don't have one that you can search by your insurance. They do telehealth. It's a great way to do it anonymously if you're worried about it being within your healthcare kind of network. So that's an opportunity as well. I think it's really important as we shift into a little bit about talking about our health. How do we protect the health of all physicians, including trainees? I think that means adequate sleep. We're going to talk about sleep here in a minute. Free and accessible mental health services, ideally opt-out counseling, creating a culture where learners feel valued on their teams and they're free from bullying. Because it's truly that our health is interconnected. Patients and doctors, when we are well, we're better able to care for our patients. We're actually better clinicians when we're well. And we know this. There's a huge issue with this, with burnout, with the health of physicians as we age, especially when it comes to things like chronic sleep deprivation and overwork and stress. And it does affect our health, both short-term and long-term. So lastly, today, before we have some questions and have some dialogue, I just want to introduce to you a tool that I created. I know Jill had mentioned it when we first started. This is a tool that I created actually when I was an intern, trying to figure out how in the world am I going to prioritize my health and take care of my 1-year-old kid and be an intern. And, I was studying and I was learning all these mnemonics, right? We learn all these things for like encapsulated bacteria and all these mnemonics for, all these things in our training, but I felt like I needed one for my health, just to help me understand how to just really manage and check in with myself every day. So this is really a simple daily check-in tool. It's really 5 simple questions as a kind of a self-survey or a self-check-in tool. So I invite you to ask these questions to yourself. Each yes to these 5 questions is 1 point. And so your score can range anywhere from 0 to 1. So the first question is about sleep. So have you had at least 7 to 9 hours of sleep within the last 24 hours? When I give this talk to residents, they often laugh at me and say, yeah, that's never going to happen. But we know that we need at least 7 hours of sleep to function as human beings, for our brains to function, even for our empathy. We know that if you've been awake for 24 hours, that if we look at MRI scans of your brain, the parts of your brain that actually show empathy, they're actually diminished without sleep. And so sleep is really important for our physical, mental health, and for our empathy. Of course, I'm going to, preaching to the choir here, but we know that consistency, really anchoring your sleep around going to sleep at around the same time each day and trying to wake up the same time, that can really help anchor your sleep. Ideally, keep your bedroom like a cave, dark, quiet, and cool, less than 68 degrees. Know that the half-life of caffeine is about 6 hours or so. So if you have a cup of coffee at noon, half of it's still there at 6 p.m., a fourth of it's still there at midnight. So if you're trying to fall asleep and it's late and you're thinking that afternoon caffeine may still be in your system, if you have a 2 p.m. cup of coffee, you're trying to fall asleep at 8 or 9 p.m., it's like having half of it still there. So just knowing that that is going to affect your deep sleep or your non-REM sleep, and alcohol is going to affect your REM sleep. For me, I was in this cycle of like, I wake up, I'm tired, I'm gonna drink coffee. I drink coffee throughout the day. Didn't realize it, but I could still fall asleep, but my deep sleep was affected. I'd wake up, I'd feel tired because my deep sleep was affected. What would I do? I'd reach for more caffeine. I didn't know this, and so I always share this with those who may not have as much understanding of the half-life of caffeine and how it affects sleep, and that oftentimes cutting back on afternoon caffeine or late morning caffeine can actually help you to sleep deeper and to sleep better and to have better deep sleep and to wake up feeling more refreshed. And so that's just something to think about. Second question to ask yourself, have I been physically active for at least 30 minutes or more today or in the last 24 hours? I think for most of us, we know exercise is good for us. It's just hard to do. But if you've done 30 minutes or more, give yourself 1 point. You know, we all tell our patients to exercise, and cancer-related fatigue exercise is really important. Muscle strength is really important. It's really important for us as we age to maintain our muscle mass. So this is cardio, but also ideally weightlifting at least, or strength training at least 2 days a week, doing at least 150 minutes per week. We know there's actually a survival advantage to about 90 minutes a day. I don't know, you're probably thinking, how in the world can I do that? So I'll show you my little, I don't often do this. I'll show you my little setup here. I've got my walking tread and my bike. You see, I just went to like Play It Again Sports, which is like a secondhand sports store. And I just bought like a $200 bike, and I just took the handlebars off and I put it up on my standing desk, and I have this walking tread. It doesn't go faster than like 3.5 miles an hour, but I can like type and do meetings. I actually try to do active meetings. I don't know if any of you, have you ever tried doing an active meeting and just see what does the person on the other side do? Okay, you're walking on a treadmill, or I do 3 tumor boards a week. I actually will walk on the treadmill while we're talking in tumor board if I'm not in clinic. I'll cycle. I write when I'm writing in one of my novels. I have very sedentary work, very sedentary habits. So that has been a way that's really helped me to get at least 90 minutes a day. I'll come home. Sometimes if I have to finish up charts or inbox, I'll just do it here, and it's at least a way. I love to exercise outdoors, but that doesn't always happen. So this is a way that I can at least kind of get some exercise in. Third question here is really about stress reduction. Am I reducing my stress in a healthy way for at least 10 to 15 minutes each day? If you're finding a healthy way to reduce your stress each day, whether that's prayer, meditation, deep breathing, walking in nature, even listening to calming music, if you're doing that intentionally every day, give yourself 1 point if you've done that in the last 24 hours. I don't know if this group has talked much about meditation. I am a huge proponent of meditation, really because of GABA, that inhibitory neurochemical that is scientifically proven to increase with meditation, not just for a day or two, but really over a couple of weeks. And that's significantly reduced my anxiety. It's cut it about in half, which has been really helpful. Meditation also helps if you are a person that's gearing up for residency, or you're about to take a big exam, or you're about to give a big presentation, and you want to be performing in a procedure. You want to be able to find in that moment, how can you reduce your anxiety or your performance anxiety? Meditation is hugely helpful. We also know that it can help with sleep, attention span, even compassion with meditation. So 5 or 10 minutes a day, same place, same time, if you can. I use an app that helps me. You can, maybe if you're a spiritual person, maybe your meditation is really a meditative prayer. And I think that whatever that is, just know that there are significant benefits to this. And your stress reduction doesn't have to be meditation, but it is one tool that can really help. So fourth question to ask yourself, have I meaningfully connected with another person today? If that answer is yes, give yourself 1 point. I love talking about the Harvard study of adult development. This study that has spanned more than 80 years, what they thought was going to predict survival, from these men it was like 1920s and 30s. They thought it was going to for sure be, hypertension and LDL cholesterol and all these things. And a surprising finding of the study is actually that loneliness turns out to be pretty bad for our health. So loneliness is that subjective feeling of being alone. It's that you can be lonely in a marriage, you can be lonely in a group of people, but you can also not be lonely and live by yourself. And so it's really that subjective feeling of being alone, but it can shorten our lifespan by about 8 years. We know that close relationships keep people happy throughout our lives. They can actually delay physical or mental decline, and they can predict longevity. So I want you to think for a moment, it's really those 1 to 3 relationships that are the most protective. So who are those 1 to 3 people in your life? Maybe it's a family member, a partner, a friend. Who are those people that you can rely on when you're in, financial or physical or emotional distress? Those are the people that matter most when it comes to protecting your health. And so how can you foster those relationships? Maybe it's just picking up your phone and sending them a text message. I was thinking about you. I just want to say that I love you. I appreciate your support. Maybe it's, having a special date night or going on a trip. Maybe it's just, a phone call once a week. My 2 best friends and I, we've started since I've come across some of this data, and because we've been wanting to do it for a long time, but we actually do every Sunday afternoon, we do a FaceTime call with my 2 good friends from college, and we just talk about our lives. And we only live 2 hours apart, and we try to get together a couple times a year, but they each have kids too, and we're, life is chaotic sometimes. But just even having that Zoom call or that, FaceTime can really help. And I think just being intentional about our relationships can be really protective. And it matters how you go about your day. So do you say hello to the person that makes your coffee or the person who is ringing up your groceries? Do you care about the people you work with? Do you know the names of the medical assistants who room your patients or the other colleagues? Those relationships are really protective mutually. And so just trying to be more social as you go about your day and showing interest in other people. And then lastly, the last question, am I eating at least 5 servings of fruits and vegetables a day? Of course, we all know that, eating plants, there's this new, I don't know if any of you have seen the new Netflix special about the microbiome. My husband and I just watched it last night, and it's really about, hey, if you want a diverse gut microbiome and you want to protect yourself from things like obesity and other chronic, even cancers, right? We know that early colorectal cancer has been linked to the microbiome. And so really it comes to eating a diversity of plants, not just eating, the same banana every single day, but really eating a huge diversity of plants. We know that this is helpful for our immune system. It's helpful to reduce inflammation, protect that gut lining, helps even slow cancer growth. Many organizations are suggesting way more than 5 servings a day, really up to 13 or more. I know it sounds like a lot, but just really trying to fit these in. For those of you in training or about to be in training like Jill, I used to have this lunchbox I'd take to work with me every day in my residency, and I still do this. Instead of taking all this time to like chop up fruits and vegetables, I would just buy produce, either have it delivered or buy it at the store, and then I would just take a whole avocado and a whole bell pepper and all of these whole fruits and vegetables, a whole package of berries, and just throw them in my bag. So I wasn't spending all this time prepping them, and then some mixed nuts as well, and maybe a mug so I could have some coffee or tea. And then I'd be the one that would like eat the bell pepper like an apple, and people would look at me funny, but it was okay. And then I would cut up my avocado with like a plastic knife and then scoop it and eat it like with a spoon. There's all sorts of creative ways to just try to fit plants in your day, even if it feels inconvenient. So just taking a little step toward that today can be helpful. So now tally up your score: sleeping 7 hours or more, exercising 30 minutes, stress reduction every day, social connections with others, and then eating well to nourish your body. Where do you score today? Anywhere from a 0 to a 5. I think for me, when I'm a 4 or 5, I tend to feel a lot better. If I'm a 0 or 1, which certainly have been on certain days, tend to not feel as well. For me, there has been a correlation in how I feel. We actually use this tool with patients with cancer. We're about to publish a pilot study on this, looking at, can it be a helpful tool for our patients as well? It's really just meant to be a simple check-in. If this is helpful for you, that's wonderful. If you can just nudge yourself in the right direction. I think if you can start with sleep, that's really the highest yield place to start. Throwing in a couple, extra fruits or vegetables a day, maintaining those social connections with forgiveness and love and laughter and intention. I think that all those things have helped me and hopefully will help you, because we really do. We deserve the health that we strive so hard to give to others. And I hope that you have that health, that joy, that meaning in your work. So that's all I have today. You can reach out to me through website, social, or email me. I have, a website that has more about the SMILE scale if you're interested. But thank you so much. Thank you, Jill, for inviting me. Thank you all for being here today. And I'm happy if we can learn from each other, have a good dialogue about some of these topics.
Thank you. Thank you so much. Yeah, I loved all those insights on just how to stay well, how to care for ourselves while we're caring for others. That was fantastic. So we have about like 14, 15 minutes left. So I was just gonna open the floor for questions. If people want to unmute and just ask a question that way, or can message in the chat either privately to me and I'll read it, or to the group. So yeah, just open for that now. I see that Matthew has raised his hand. Yeah, go ahead.
Hi, thank you, Jill, and thank you, Laura, for that presentation. That was really good. I work in the Office of Wellbeing here at Michigan Medicine, and we recently, in the last couple of years, we've applied for and received this. It's actually called the Joy in Medicine Award from the American Medical Association. And it's largely geared towards putting structural components in place to actually improve the system in which people work. We know that healthcare workers are often more resilient than the average person in the population. And so, putting the resilient person in the burning house, sometimes it doesn't matter how resilient you are. And so I like Dr. Christine Sinsky's quote on this. She says, burnout manifests in the individual, but it originates in our systems. And so we're always thinking about ways that we can improve the way we work. And our new chief wellbeing officer here, she comes from the University of Colorado, Dr. Elizabeth Harry, and she does work on cognitive load. And you mentioned distractions constantly just being embedded in everything that happens in healthcare. And just wanted to ask you what you think about the structural component and what you've maybe seen or experienced or been a part of that has helped actually improve the system in which healthcare workers spend their day to day.
Yeah, well, thank you for the work that you're doing. It's interesting. Part of the things that I'm interested in, that I talk about, it means that I'm on a lot of committees or get asked to be on a lot of committees. So I think I'm on like every single wellness, well-being committee on campus, including an advisory council to our, chief of well-being on campus. And so we talk about this a lot. I think most of us in healthcare recognize that we are highly resilient people. We're talking about strategies to help here, but we're also talking about some of the underlying structural factors and some of the issues within healthcare. Some of the things feel impossible to fix, like having to spend 2 hours of my day to do a peer-to-peer because they won't improve my patient's chemotherapy, right? Those things are incredibly frustrating, right? But if we can continue to what we call, at least what we call it, is kind of misery reduction. So when we're having these conversations as clinicians, we think, okay, we know that there are some things that we wish we could just snap our fingers and fix and not have a healthcare system where there were inequities or we had to have waste of our time with things like insurance hassles. But within the things that we can control, how can we reduce misery? And I know that seems kind of funny to say, but what are we doing that doesn't need to be done? Are there duplicate trainings? Are there unnecessary modules? Are there hassles that doctors, nurses, clinicians, nurse practitioners have to deal with that are unnecessary? That would be the first thing, is just trying to reduce and eliminate. Can you eliminate or reduce the amount of notifications? So is it necessary that a person is paged about a certain thing? Is it necessary to get a message on that certain topic? Can we reduce email burden to our clinicians who get, I don't know about you, I sometimes get 50, 100 more emails a day, right? And it can just be overwhelming between my inbox and if I'm working and I cover another hospital system and my emails, training, all these things that just add up that, oh, my mother's a primary care doctor. Why does the deadline for a certain module have to be on December 31st, right? Because what doctors end up doing is that they're just busy taking care of clinicians. Can we move deadlines to times where they may not already be off for vacation? And so here they are trying to celebrate New Year's Eve and they're thinking, I just got an email, this module's due, right? And so there's a lot about documentation, about all those extra things. Can we reduce and ideally eliminate? And can we provide, I think it really comes down to eliminating useless stuff, having a reasonable workload and adequate support. I am so fortunate. I have an RN who sits next to me in clinic, who is my dedicated RN, and all she does for me every day is manage my inbox, triage patients, call them when they send us a message. If they're in the emergency room, she calls their family, she reviews their lab, she asks me questions, she calls them, and then she puts in all my orders, right? So she takes away hours and hours and hours of my work. When I'm not in clinic, like today, she'll get a call from a patient, she'll get a message, she'll call the patient, she'll give me a recommendation on what she thinks. I'll say yes or no, I'll sign the medicine or not, she'll do my refills. I think pharmacy support, nursing support, they really help us to work to the top of our degree, but a lot of doctors do not have that support. So reasonable work hours, adequate support, and eliminating useless stuff. I think that just that alone could go a long way for most doctors. I don't know if other people in the room have thoughts on that or other things you found to be helpful. I know we're doing a lot of strategies. I mentioned like scribes, or now we have AI note writing. I don't know how those are going to actually work in day-to-day practice, but if we can do things to try to help eliminate documentation demands or other extra stuff and get more toward that doctor being able to have time with that patient, I think that's where we derive the most meaning in our work. I think that's where patients have the best high quality satisfied care, and just keeping that the focus of everything. How can we just take away everything else? I think that would go a long way. But thank you for the work you're doing, Matthew. I also see Barbara put a comment in the chat too, to you, Matthew. She says, we give lip service to working at the top of one's license, but we do not really enforce this. Triage nurses doing more work on their own. Dr. Vater has a nurse who takes messages and puts in orders. Do I have that support? No, I don't. Right. And almost none of the doctors that I know have that type of support. But I have that support as an oncologist, and it's not fair. It's not fair just because the service that I'm in has an infusion center and happens to make money for the clinic or the hospital. I think that my mother, who's a primary care doctor, she would probably benefit more from a nurse than I would, right? Because she has even more that she has to manage. But I think if we all could have that type of support, it would really reduce burnout. Thank you, Barbara, for sharing that.
Yeah, no, thank you so much for that discussion. And I actually have a question, just kind of like as a future trainee, very in just a few short months, and thinking about how to promote wellness in my residency. I mean, what are ways that you recommend as a resident to promote like wellness and health of like your co-residents and just like of your residency in general? Like, how can we speak up when we feel like we're kind of the second lowest prong other than medical students?
Yeah, just knowing that you have value. We've proven that in study after study after study. Not only do residents bring revenue in for a hospital system, but they have true value, compassionate care to patients, thorough care. Without residents in many places and many safety net hospitals, many patients wouldn't get care at all because they help to extend that care. It can be hard. It's really hard to be a resident doctor. I know we've made a lot of progress, right, with Libby Zion and the work hour reductions, and all in all over the last really 30 years, there have been significant changes in residency health. And now I know, because a lot of people share this with me, that they can say, yes, I'm only supposed to work 80 hours a week, but I really work 110 hours a week, but I only report 80, because if I report more than 80, then my program gets dinged. So there are problems, right? There's reporting errors. We do know that residents are working a lot more than the hours would say. And it can be really hard when you feel like you don't have the professional security to speak up. But know that you have advocates, you have upper level residents, you have chief residents. I have found over and over and over that program directors are good people who care about their well-being of their learners. They want to train good doctors and they want to protect their health. And I would say almost every single program director I've ever worked with, that's been the case. And they've just been wonderful people. And it really comes down to staffing, right? So if we're talking about reducing hours and still training excellent doctors, how do we do that? It really comes down to how big is the residency program, and do we have the ability to shift, and do we have really good sign outs? I think that as a resident, you're going to feel like an intern that you don't have much of a voice, but you do, right? Just know that it's going to go a lot further to recognize a certain rotation, that there's problems, it's just not good for learning, or there's really a lot of things with the culture that aren't good, or safety for patients. And knowing that you have people that really want to make those things better, but we always want to be part of the solution rather than just pointing out problems. So the more that you can create relationships with your co-residents, the leadership in your program, often programs have town halls and you may not feel like you can speak up, but there's written anonymous feedback. If something is not working well, continue to bring it to the attention of the people that you have developed relationships, and then try to strategize what are the solutions. At least in my residency program, we made a number of big changes when I was a resident and when I was a fellow. And it really came down to creating those relationships, figuring out what was the problem, really looking at the data, and then saying, this is the strategy going forward. And then if something, we talk and say, okay, that strategy unfortunately won't work. It's a budget issue, it's your staff, whatever. Let's look at, is this a possible solution? Okay, is this a possible solution? And just really being part of driving those solutions, I think goes a really, really long way as a learner.
Yeah, no, I love that for sure. Um,
I also see another comment in the chat. Couple things, Jill, or you can read them too, Jill. I know you're moderating, but if you want me to read, you can too. But Barbara says, I would encourage you to enter residency with the intention to reach out to a few other residents and do small things together, out for dinner, bike, hike, small personal time with someone else. Most people enter residency expecting someone else to reach out, but if you are willing to reach out to a few other residents, you will find some people who you can become friends with. And that's great advice. I think paying attention to uh, just the people around you, caring about them as human beings. If someone feels like something's off, if you're leading a team and your medical student is just not themselves, check in with them, or care about the people around you, and you're gonna and be willing to be social. I think that's great advice. That's gonna really help you feel like you've got a core group of people. And then Jenny says, I've heard the good advice of pretending you're advocating for your best friend. For those of us that are people pleasers and don't want to speak up for ourselves. I think that's wonderful, Jenny. That's great advice. I think also thinking about you're advocating for your best friend, you're advocating for the people that are coming after you. And most likely, if you've been through something and it didn't go well, you're probably never going to be through that rotation again. And you really are going to be making changes to help the people that come after you. And that's a very, very important thing to do.
that's very true. And I see that Teresa has raised her hand, so if you want to unmute and ask your question.
Sure. Hi. So I just wanted to say that I greatly admire you, Dr. Vater, and I also went to Notre Dame for undergrad, and I was in Welsh fam, so girl whirlwinds. And I just graduated last year. I'm doing a year of service in Denver, Colorado this year, and I'm planning to apply to medical school. And I just think it's so great that you're advocating for wellness and well-being, especially in this profession. I've just seen burnout amongst many of the healthcare professionals at the federally qualified health center that I've been serving at. And so I think it's just so relevant. So I'm looking forward to following you throughout medical school and residency and using your tips and guidance throughout my journey. So thank you for all that you do.
Thanks, Teresa. We had a very similar journey. I did a year of service right after graduating, and then
Oh,
jumped
great.
master's in public health, and then jumped into med school. But just that experience you're already getting and your interest in this so early, I'm really excited for you. Please stay in touch.
Thank you so much. I appreciate it.
And I think Tiani has a quick question that we probably get to in time.
Thanks, Jill. Yeah, hopefully it's a bit quick. I'm Tiani. I'm a medical student and applying into internal medicine. And I'm interested in oncology and do find a lot of joy in creative writing as well. And this whole talk really resonated. And I guess this is kind of a specific question, but probably also generally relevant for people who find joy in certain hobbies. I was really curious how you find the time or carve out the time to continue writing on top of also exercising, spending time with the people you care about, and having medicine in your life.
Yes, that is. Thank you. Thank you for that question. And I do have a few extra minutes, so I can hang out for a little longer. I think that writing helps you to be a better doctor. I started really writing when I was a medical student. You have a very early love of it, which is wonderful. I actually now set up myself for health a lot better with my writing, because I used to sit and write for 10-hour days on the days that I could, because it took me 7 years to write my first novel. And I'm working on my second novel, and it's just amazing how much quicker it comes when you know what you're doing for the second time around. But now I have a standing desk, a walking tread that was like $130, and I got a stationary bike. I took the handlebars off. I slid it under so I both cycle and walk while I write or do other things on my computer or study. I took, if I have to, thankfully not for a long time, but when I'll be taking boards again. So that's one strategy to maintain your health. But I think just a few minutes a day, it may be only 10 minutes a day. I used to wake up just a little early when I was a resident, just so I could have a cup of tea and write. And sometimes that would just be reading what I wrote yesterday, so my mind would just stay in it, and then I would be commuting to work and be thinking about it. And then I'd have a little inspiration when I was at work, and I'd make a little note in my, on my notes folder, and then I'd come back. And it can be a slow process, but when you have a little bit more time, then you can come to it more. But just If you go months and months and months and months without it, it's a lot harder to stay in it than just even 5 minutes, just a couple minutes every day. For me, that was the morning, and that really helped me to continue to just kind of chip away a little bit at a time.
That makes a lot of sense. Like little doses of consistency.
And it's fun too. It's fun to have a little something that, for me, writing pulls me out of the busyness. It helps me to slow down. It helps me to pay attention. Those are things that I try to do in my clinical work, but I think that writing, it helps me to cultivate that skill in my daily life.
Mm-hmm. Yeah. Thanks.
All right, so I think that we are out of time, but just like Teresa said, I also really admire you, Dr. Vater.
Water like water. Yep, water like water with a V.
Like water. And your work to promote physician wellness and especially resident wellness as well. So it was really great to have you, and thank you everyone for joining. And we hope to see you at our next talk next month.
Thank you so much for having me. It's been wonderful. Take care.
Okay. Thanks.